About 10 years ago, I was just doing my regular suburban life, stay-at-home mom, writer, and one winter I started having knuckle pain, and this is what I told my doctor. I was having issues, so I went in to see him, and I said, well, my knuckles have been sore, I just feel tired. He said, well, let's just do vitamin B. And I said, okay. And also, I've been getting these weird things where my fingers change color and they feel cold, and they're kind of blistering. And he said, okay, that's really specific. It's a syndrome called Raynaud's syndrome, and it's an autoimmune thing. And I said, and also, I've lost like 25 pounds without trying, and it's getting to the point where I'm kind of worried about my weight. And he said, stop, we're doing tests. So that's what it was. It started with, oh, it's probably just vitamin D2. There's something about having Raynaud's, and there's something about losing weight accidentally. And so the results were, like lupus. Not all the markers for lupus were there, but mixed connective tissue disease is what they call it when it's sort of in a holding place where they don't know if it's going to turn out to be rheumatoid arthritis or lupus. And I felt horrible because I thought, I'm too young, I'm in my 30s, I have a toddler, I'm too young to have like this kind of disease. And every 6 months I would go back to be tested. There wasn't a whole lot they could do. I felt better after a few months because it's technically a flare. I would still have the, my toes too, my toes blistered because of this weird condition. But I felt better not going to the doctor. And they would call and be, it's 6 months, you got to come in. And I thought, even then I knew, thinking about it made it worse. And then I had something that was a lot more pressing, and that was I started getting really severe bladder pain. I went to see a urologist who said, well, we're not sure what it is. There's a procedure we can do where we put you under and we distend your bladder, and then we can kind of see what's going on. And I came out of it and he said, wow, so I have to tell you that you have something called interstitial cystitis, which is ulcerations and inflammation of the bladder. And in about 10% of cases, you can actually, as a doctor, say that's definitely IC because they can see, they're called Hunter's ulcers, and you can see. So he said, here's some Vicodin. Basically, sorry if I didn't believe you before, you definitely have this thing. And he treated me sort of like, it's this thing you have now. And I had been working part-time, I stopped, and I got really upset, depressed about it. And I believed him, I believed it was gonna be worse than it was. But I went in every 2 weeks for treatments, for installation treatments, DMSO treatments, and my whole life I thought was gonna be that. So I dealt with that a few years. But I did know, I was meditating, I didn't know about Dr. Joe, but I did know that I felt better when I wasn't thinking about it and when I was meditating. And then I found Dr. Joe on YouTube. I attended Dr. Joe Progressives. I did a couple of them, and I was interested, and it's something really resonated with me. I liked the research, and it was thoughtful, and it was well-rounded. It wasn't just spiritual. And it wasn't until I went to Indian Wells, though, that he said, okay, we're going to do something. It's going to be this healing thing. And I thought, okay, it's not what I'm here for, but okay. And I was teamed up with this really great woman. And at first, she healed me, or, she did the thing on me, and it felt really great. And then I went to do hers, and I'm just kind of, and I feel this electricity. And I imagine that this was love, right? Just like a bolt of love in my hands. And then I realized as I pulled it out that the hands don't matter, because this love, this concentrated ball of love, is everywhere all the time. It's just we're not focused on it. So it's like, it made me feel like we're swimming in this all the time, but unless we're, and I think that's why doing this with your hands helps, because you're focusing on it. And I I turned my hands and she started like convulsing, and it freaked me out. I wasn't really sure what to think, but we're friends now. We kept in touch and we hugged and we cried. I cried, and I felt as though, you know, I was a conduit for something. It was like nothing personal, it wasn't me, but I was helping to focus and funnel something at her that was already there all the time. And that's when I started to realize that, because then of course I was really interested in doing healings. I felt great during and after, but I realized that going in to do a healing, walking into the room, seeing that person on the floor, they're already healed. They just don't know it. And that really took a lot of pressure off of me. I wasn't like the healer, I'm just the middleman, right? I'm just kind of there helping. And every time I do one, it gets more profound and more beautiful. And I just love it. I went in to see the lupus doctor somewhere around this point, and he said, the markers came back and we can officially call it lupus now. And I thought, but I feel good. I feel really good, you know, isn't this just a test? But I feel great. At about the same time, my urologist who diagnosed me with IC, he left and a new person came in, and she said, we're redoing all of this. I'm redoing this whole thing. And she did the same procedure, and she said, you don't have IC at all. And she started off by saying, you know, some doctors think they know things and they don't. And I said, well, would you look in the file? Because he had pictures. And she said, oh, really? And she went and she had photos. I definitely had IC, and I definitely didn't. So, I mean, that's the one bit of, like, you know, evidence that I would have. But the more I heal others, the better I feel. And I'm healthy, and I feel like the narrative that a person has is important. I tell the story that I'm healthy and I'm healthy. And no matter what it is, if my back hurts and I think about it, it's gonna hurt worse. If I think about something else or someone else, then I feel really great. I really would love people, like if somebody sees this, to know if you come to an event, everything is gonna be beneficial at some other time. It doesn't, I mean, healings, I always thought a healing was you go in, you can see, you can walk, boom, it's done. But there's also a kind of healing that happens where it's incremental and it builds, and you may not even realize, but thinking differently and meditating, and you know, that does it too.